and we'll start getting some feedback from the audience in that platform. Okay, so you should be seeing now just the open slide with the grey picture, grey background with us. And so welcome to today's webinar. So let's just get to this question here. So you should be able to refresh your menti.com by swiping down on your phone. Okay, so we've got some responses there. This updates real time, so which is great. So we can see some of what's happening. Okay, so now it will help us to guide the discussion if we understand a little bit more about the people here and some of the experiences that you've had. So the closest city to you. Okay, so Adelaide, Blenheim, Edmonton, Perth, Adelaide, Gold Coast.
Oh, someone's here from Ottawa. Oh no.
Yeah, they're keeping an eye on you.
No, I'm from Ottawa originally. So.
Marrakech.
Right, you can run, but you can't hide.
Somebody's stalking you.
All right, there we go. So we've got people that, from everywhere around the place, which is good. Great to have some internationals attending. So what industry are you working in? Okay, so this is the word cloud. They just come up as people put them in, and the more people put a word that's the same, the bigger the word gets bigger. So it's quite good to see, you know, who's here and what the mix of the attendees is. Okay, fantastic. So education, consulting and transport seem to be the biggest. We've got some defence, events and conferences, manufacturing, disability, local government, fantastic. Energy generation. Okay, fantastic. And what sparked your interest to attend this event? This is just open text. Jeff asked me.
Men talking about vulnerability. Yeah, it's pretty rare, isn't it?
It is rare, but it's nice to see some comments about it now and even discussion about it, because I think the world has changed and we need to acknowledge that it's changing rapidly.
Yeah. General
male-dominated industry. Yeah, how many times have we heard that with male-dominated industry where mental health is a big issue and it's not talked about much.
It's particularly gratifying to see the resonance that this particular event has created, Jeff. It really is. Yeah,
I'm really pleased with the reaction we got from it. I'm not sure where some of the people are, but we had a lot more booked on than this, which is a little disappointing, but you just got to go with what you got. But there's some fantastic comments there. I think, you know, what strikes me is some of this vulnerability and people being actually more open to talking about it.
And in terms of attendee, in this particular realm, what people tend to do as well is log in so they get access to a recording, as well as the option of joining in.
So hopefully that's the case, and hopefully it gets shared. As we've tried to make it as open as possible for people to attend this one. All right, fantastic. So there's some great comments in there, and I think we've allowed multiple comments. All right, fantastic. So now let's explore some issues so we can help guide the discussion. So do you have someone that you can really confide in? Sorry, that's my disabled boy in the background, if you can hear him.
Yeah.
Okay, so that's good. So the hell yeah has got the most, obviously, which is great.
Yeah.
People do have someone to talk to, because if you're not, you're an island on your own. And not really sure. I kind of expected to see some of them. Interested to see what the other panelists say about that. But I think there's when we're in a world of it's not safe to talk about it, or we don't have an environment in the workplace or in our friends or colleagues that we think we can feel safe talking about it, then maybe we don't.
Yeah, and I think that might well differ from industry to industry, and probably from gender to gender.
Yeah, I'd agree with that. Yeah, absolutely.
Still, it's promising.
Yeah, it is. Okay, so so I put this slide in just because the next series of questions have sliders in them, so you can follow, click on the dot and slide the dot across to what response you think and submit it. So you can just touch the line wherever you like, from strongly disagree on the left-hand side to strongly agree on the right-hand side. So this is just a practice one before we get into the next slides, because they have multiple sliders. Okay, that's good. So everyone's having a bit of just a practice run with that one, and we'll get started in the other one. And it brings up this interesting waveform in the background. So then the average number in the dot is not necessarily reflective of the overall results, and there's a spread around it. So it's interesting to see the waveforms that it creates. I thought it might add to the discussion or give us some points to bring up. Okay, so I'll bring up the next one. So each slider, each line has a separate response. So think about each one individually. So I feel comfortable talking about mental health, never, with family or with a friend or whatever. Okay, so we're getting some mixed results there, and interesting that I never feel talk about it is still mid-range. So,
Yeah.
so
And
let's talk
with a
about,
work colleague also, Jeff.
yeah, let's just talk about them one by one, and then we can get some discussion going. So, for the attendees, please feel free to put comments in with the three dots, and we can see comments. So more comfortable talking about mental health or someone else's. Yep. So
someone else's. Absolutely.
So interesting, the families up there, and a friend and support network. So depending on your personal situation, obviously we'll have different results. Work colleague is down a bit.
Yeah, for me that's no surprise to a degree, in that people at work, we don't necessarily see them in that role.
No.
Whereas family, sure, a bit more with friends certainly, and support networks, well, that's kind of why they're there. But we don't tend to think of our colleagues as being a supporter in terms of mental health, and I think we keep our boundaries up more for various reasons that we'll explore. So that's no surprise there. It does surprise me a little bit where the blue line is. Still the overall comfort level of talking about mental health.
Yeah, so I'd say there's some sort of shift, but there's still a lot in the I don't ever feel comfortable talking about it. I saw one comment there before about a work colleague. Thanks for putting the comments in. It really helps with the discussion. So the judgment that goes with this topic still, and someone said they felt more comfortable talking with a work colleague who was like a friend, confidant colleague, rather than a manager. And that can often be the case too, I think.
Yeah.
Yeah, some more
I'll,
comments
I'll
coming
give you
through.
one that might be interesting. For me, I actually feel extremely more comfortable talking about it to women than to men.